Hey, Mitch,
Good morning.
how are you?
Decent. How are you?
Good, thanks.
Good.
Happy to see our back members here.
Trying to figure out why mine says iPad. It's never done that, and I've never changed it, so just to my name.
Oh, you should be able to click on the top right of the box you're in, and it should say rename of your own little window. I'm just about to do that, maybe. Nope. I can't do
I'm on
that.
an iPad, so mine might be a little bit different because of that.
Hmm. I don't see that either on mine as an option. Hmm.
I'm gonna turn it off while I'm messing with this for a second.
Nice to see you.
Hi, everybody. Thanks for joining today. I think we're just waiting for Kathy before we get started, so we'll give it a few more minutes.
Good morning. Sorry, I was having a little trouble getting to Zoom for some reason. Welcome, folks. I'm just taking a quick look to see who we have. My name is Kathy Cohen Del Rio. I use she, her pronouns. I'm the chair of the Maine Care Advisory Committee. I also work at Maine Equal Justice. And let's give folks another 30 seconds to join, and then we'll kick off introductions. Lisa or Kayla, can one of you rename me? Because apparently I logged in with my organization Zoom and not my personal Zoom. Again, welcome folks who just joined. My name is Kathy Cohen Del Rio. I use she, her pronouns. I'm the chair of the Maine Care Advisory Committee. And I also work at Maine Equal Justice. And excited to see you all today, and excited because today is also a new beginning for the MAC. We have with us some of the members of the new BAC, the Beneficiary Advisory Committee, and we're really excited for those of you who are from that to be here today. And we're also going to do things a little bit differently today in terms of our format, and this is like an ongoing thing that we'll be trying to do, is changing, oh, thanks, Kayla, changing a little bit of our format in order to make sure that it's inclusive of people who are particularly not providers or who are not quite as in the weeds on some of the policy stuff. We're going to kick off how we normally do with quick introductions where people can share their names, their pronouns, what brings them here today. Normally at the end of normally we do this by doing MAC members, Maine Care members, and then have an opportunity for people who are guests to also go off mute and introduce themselves. But we're going to do things a little differently today because we need to make sure we have space for all the new folks. So we're going to do MAC members. I'm going to pass it over to Kayla. Correct me if Kayla helped me prep for this meeting and did a lot of the pre-thinking. Correct me if I'm misremembering, but I think I'm going to pass it over to you to introduce the BAC members. Then we'll do Maine Care members, and folks who are here as a guest, if you could just introduce yourselves in the chat today for time, that would be great. And then normally, I know most of you who are here know this, but I know we also have new people. I do the MAC member introductions by reading through the list of members so that we don't have so people aren't trying to figure out who's next. Okay, hold on one second. My screen is not quite doing what I want to do. There we go. All right. Miriam Bashir. Nielsa Onley. Norma Desjardins. Catherine Brandt. Ian Yaffe, Jessica Drenning, or Vanessa DeWitt. Marianne Heracall or Eric Fromberg. Hold on one second. Adam Bloom Picopoulos is not going to be here today. Kathy Dion. Is Suzanne Farley here for Adam? Becca Matasovich or Kaylee Hess. Vicky McCarty. Rachel Collmore.
Morning, everybody.
Do you want to
Oh,
say?
sorry.
Um,
It's second Monday. Yeah, Rachel Collmore, Consumers for Affordable Healthcare. I'm the Consumer Assistance Program Manager here. So she, her, hers.
Thank you. And I was getting worried that maybe my computer was like muted and I didn't realize it. So I'm very glad you're another
No,
voice.
totally me, Kathy. You're all good today.
Sarah Squires.
Good morning, Sarah Squires, she, her pronouns, Public Policy Director at Disability Rights, Maine.
Gia Drew.
Good morning, Gia Drew, Executive Director at Equality Maine, she, her. Thank you.
Susan White. Or Lori Belden.
Good morning, Susan White, Home Care and Hospice Alliance, she, her.
Catherine Hamilton. Leo Delicata.
Morning, Leo Delicata. I'm a lawyer with Legal Services for Maine Elders, and I use he, him pronouns.
Sarah Lewis. Laura Cortez.
Good morning, everyone, and good morning and welcome back, members. My name's Laura Cordes. I use she, her pronouns, and I'm the Executive Director of the Maine Association for Community Service Providers, MACSP.
Rachel Dyer.
Hi, my name's Rachel Dyer. I work for the Developmental Disabilities Council and I use she, her pronouns.
David Winslow. Ann Sedlak.
Hi all, Ann Sedlak. I use she, her pronouns. I'm the Director of Advocacy for the Maine Medical Association.
Bobby Martin.
Good morning, Bobby Martin, he, him. I'm the Director of Community Health Innovation and Partnerships for the Maine Primary Care Association.
Candy Sherman.
Good morning, Candy Sherman. I'm the Director of Health for the Penobscot Nation, she, her, hers.
Teresa Cochran or Kristen Goddard. Okay. I'll make sure we remind folks who join late that they need to let you know, Lisa, that they're here so for the attendance. Let's pass it over then to Kayla for the new BAC members.
Thanks, Kathy. A very warm welcome to our Beneficiary Advisory Council members. This is their first time joining the MAC. We're happy to have you here. So what I'm going to do is I'm going to run through each of your names. If you're here, when I say your name, feel free to come off mute and say hello and share your pronouns if you'd like, and I will start running through the list. Do we have Ashley Matthews here? Mariam Bashir? Zakia Sheikh? Andrea Dole?
Hi,
Anita?
found the unmute. I'm here.
Hi, Andrea. Thank you. Sorry to cut you off.
Yeah, I live in Belfast, Maine. I have a couple of young children, one with complex medical needs and disabilities, and I use she, her pronouns generally, unless I'm talking to a tree, and I don't think they mind. Yeah. Thank you.
Good to be here. Happy to have you here. Anita?
Hi, Anita Tavanin here. Thank you all. I'm a BAC member, excited to join here. I also have a 10-year-old son with a rare genetic disorder, and I'm here excited for the opportunity to advocate for children with special healthcare needs.
Thanks for being here, Anita. Welcome. Elizabeth?
Is it Marie Elizabeth?
Yes.
Yes, hi, that's me, she, her.
Thanks, Marie. Christy?
Hi, I'm Christy Woods. I use she, her pronouns. I live in Augusta and I'm a BAC member. I am a registered nurse, but I'm currently disabled because of my condition, myalgic encephalomyelitis, or some people know it as chronic fatigue syndrome.
Thanks for being here, Christy. Welcome. Luke?
Hi there, I'm Luke Quinzambi. I'm based in Portland, and you can call me Luke. You can say he, him. I'm an African. I'm not super comfortable with this, so he, him. Yeah, and yeah, that's pretty much it about me so far.
Welcome, Luke. Thanks for being here. Maya?
Hi there, I'm Maya Steinberg. I'm from Belgrade, Maine, and I use she, her pronouns.
Thanks for being here, Maya. Mary? Mitch?
Hi, good morning, everyone. My name is Mitch. I live down in Stockton, and I'm a member of the BAC, and I'm also a Maine Care recipient due to intellectual disabilities. And he, him, and I'm glad to meet everyone.
Welcome, Mitch.
Thank you.
Rachel Ward?
Hey, I'm Rachel Ward. I'm a Maine State Parent Ambassador, and I have a slew of other boards and crazy things that I do when I can. I am currently considered disabled because I have diffuse myofascial pain syndrome, which is just a really fancy way of saying my muscles tell my body I'm in pain even when I'm not supposed to be. Super fun.
Thanks for being here, Rachel. Rhonda?
There we go. Good morning. I live in Gorham and I don't care what pronoun I'm called, whatever works for me. I am a retired respiratory therapist after 35 years of working in the Maine health system, NICU, PICU, and the pediatric adult clinic. And for the last 10 years, I am now retired, but for the next 10 years, 35 Maine Med, and then 10 at Intermed doing asthma COPD education. I'm very happy to be involved with BAC, and I'm excited to hear more about MAC. Thank you.
Welcome, Rhonda. Teresa?
Good morning, Teresa Kim, she, her. My daytime job's Unified Asian Communities. I'm currently in Standish at home with my children, who one suffers from PTSD separation and my other one is on the spectrum. Thanks.
Thanks for being here, Teresa. And Wanda?
Good morning, everyone. I am a single mom of 9 and 11-year-old sons, and I am an advocate of children who are survivors of domestic violence and sexual abuse.
Thanks for joining, Wanda. That concludes our list of Beneficiary Advisory Council members. If you happen to be a BAC member and joined after I started the list, feel free to go ahead and add your name to the chat so folks know that you're here. And I'll pass it back to you, Kathy.
Thank you so much. And just to remind folks, BAC members will always be welcome here. But also part of the process, the BAC members will eventually be choosing representatives to be members of the MAC. And those of you who've been around for a while may remember that a certain percentage of the MAC now has to include BAC members. So we may not see everyone every time, but you all are welcome anytime. And I'm going to pass it over to Maine Care to introduce their folks. And I see Michelle is here, so I'll start with her.
Hey, good morning, everybody. Special welcome to our BAC members. I was able to join most of their inaugural call and just super excited to have you here with us today, to have the BAC stood up, to be able to hear your voices, and really excited for the direction that we're moving in. So thank you for choosing to spend your time with us and share your experience and expertise. My name is Michelle Probert. I'm the director for Maine Care. I use she, her pronouns. You'll be hearing from me a bit more in this meeting. For right now, I wanted to take this opportunity to introduce a new member of Maine Care's senior team. Dan McCool is a pharmacist. He's also a professor of pharmacy. Most recently, he worked for Hudson University. He's also worked in a number of provider settings, including hospital and primary care. And we are super excited to have him on board. Dan, would you like to say hello?
Hello, everyone. Dan McCool. I go by Dan and Dr. McCool. I've been in clinical practice now for 38 years as both a professor and health system senior management. I still hold an appointment at Maine Dartmouth Family Residency, where I have students and learners of all sorts. And I also head up an interprofessional education collaborative. And so I love working with folks of all sorts, patients, nurses, pharmacists, physicians, social work. It's just fantastic to bring people together. And I'm looking forward to bringing those skills here with this team. Good to be with you all today. Thank you.
Great, thanks, Dan. And we can go through other Maine Care folks. We're still doing that this morning, Kayla, is that right? Yes, okay. I'm playing the looking at the squares on the page game. And I see Shannon next. So Shannon, I'll turn to you.
Hi, everybody. I'm Shannon McGrath. I'm the Employee and Provider Engagement Manager for Maine Care, and I use she, her pronouns, and I will pass it over to Sarah Fisher.
Good morning, everyone. I'm Sarah Fisher. I'm the Maine Care Outreach Specialist here with the Office of Maine Care Services, and I use she, her pronouns. I will pass it over to Mandy.
Hi, good morning. My name's Amanda Lee, and I'm the rate setting coordinator for the Office of Maine Care Services, and I use she, her pronouns. Let me see who's next. Jan, have you gone yet?
Good morning, everyone. Thank you, Amanda. I'm Jan Wright. I work with the pharmacy unit. I'm so excited to have Dan join our team, and I'm happy to be here to help support the mission. And let me see, I'll pass it on to Kristen Merrill.
Good morning, everyone. I'm Kristen Merrill. I'm a Senior Policy Manager with the Office of Maine Care Services. I use she, her pronouns, and I will pass it over to Jessica Miller.
Good morning. I'm Jessica Miller, Associate Director of Policy at Maine Care. Use she, her pronouns, and welcome back, members. I'm trying to see who else is on. Lisa?
Good morning, Lisa Weaver with the Policy Unit. I use she, her pronouns, and welcome to the new BAC members. We're really excited to have you join us. Amanda Lee?
I just went, but I think I see Shannon.
Shannon.
Good morning. My name is Shannon Beggs. I'm a Provider Relations Specialist, and I use she, her pronouns.
Is that all
I'll
the
jump
Maine
in.
Care folks? Oh, go ahead,
Yep,
jump in.
Kathy, sorry. No, I'm sorry. It's Sarah Lewis with Maine Access Immigrant Network, and my pronouns are she, her, hers. Thank you so much. Really good to have the BAC folk here. I'm just so thrilled.
Yes, thank you, Sarah. Great. Is that all the Maine Care folks?
I missed Elizabeth Hardy.
Okay.
Yep.
Hi, I'm Elizabeth Hardy. I use she, her pronouns, and I am the Office of Maine Care Services Communications Team intern this summer. So hopping in here to kind of learn and see what this is all about. And I'm excited to see everything that the MAC and BAC does.
Thank you all. And if there's any MAC members or BAC members who joined after we did introductions for that section, if you can introduce yourselves in the chat, that would be great. And then also, again, a reminder, if you're a guest today, you can introduce yourselves in the chat as well. We are going to have a chance to connect a little bit more in a few minutes. And I know we're running a tiny bit behind, but we'll catch up. So I'm going to just take a second to go over our agenda and just point out a few things that are a little different today. So we right now are going to do an overview of the agenda. Then Kayla is going to talk a little bit more about the back member process and welcome folks. Then we're going to break up briefly for a meet and greet in breakout rooms. We thought it would be a nice opportunity for relationship development, both for MAC members and for back members, and for staff as well. And so you'll have a chance to go into breakout rooms and get to know each other a little bit better. And then we'll come back to have Michelle Probert and Ian Yaffe, who I see is now here, be able to provide a high-level update based on the bill that passed in Congress last week and what that means for Maine. And then Michelle will continue on, Ian will continue on to talk about updates from OFI, the Office of Family Independence. And just a reminder for folks that here in Maine, our MaineCare program has 2 offices that help oversee it. So you have the Office of Family Independence, which does eligibility for all of our DHHS programs. And that's where people apply and where people notify the department if they have any changes to their situation. And it's also where decisions around ending coverage happen. And then MaineCare, which is responsible for all the services that are covered, for all the processes behind whether services need prior authorizations or what the rates are for different services, and also where like pharmacy services live, all those things. That happens on the MaineCare side. So we have people from both of those departments within DHHS that are here each meeting. Then Michelle Probert will give an update about other MaineCare pieces. We are going to take a brief break this time around. And then I'm going to do a quick overview of the draft bylaws for the MAC and a reminder about some other upcoming changes. And then we're going to break into topical breakout rooms where you get to choose which breakout room you want to be a part of. We did share the descriptions in advance, and we'll lift those back up again before that part of the meeting. And then we'll have a quick time where we come back together at the very end and end the meeting. And we are going to have a survey that will go out so folks can tell us what worked and what didn't work about this meeting today, since we are trying some new things and we have a bunch of new people. Any questions about the agenda or process for today? I also just want to note that we are trying to be clear whenever we are using like abbreviations for something to say what that something is. So for example, OFI is Office of Family Independence, or if we're talking about a certain section of policy, we would say this part of the policy relates to people with intellectual and developmental disabilities, so that people have those that context. So we're going to try not to just yell out a lot of abbreviations or weedy words without telling you what they mean. But if we forget and slip into old ways, please don't hesitate to raise your hand and ask a question or put it in the chat, and we'll be happy to make sure that we're being clear. Kayla, I'm going to pass it to you.
Thanks, Kathy. I just wanted to give a quick update today because we have not met since the Beneficiary Advisory Council officially came together and had their first meeting. So I wanted to give a quick update on where they're at with developing their group. They did have their first meeting on June 3rd. It was a great meeting. There were some state staff there who will be the main support folks and the back members. So we did some meet and greet and get to know you activities. They also reviewed their bylaws and voted and approved on their bylaws. So they have a formal set of bylaws up on our website now. And they have some upcoming milestones that I wanted to flag. They'll be working together to decide who will be the formal MAC members, so the folks joining the MAC on a regular basis. They'll also be starting MaineCare orientation, so getting to know some of the behind the scenes back end parts of MaineCare, so some education. And they'll be working on setting their agendas. So lots to come for the BAC. Their next meeting will be in August. Very excited to have them on board and kicking off. And I think I'm rolling us into the next agenda item, which is our meet and greet breakout rooms. So I will launch right into that. I've set up breakout rooms with 3 to 4 folks in each room. We're going to let you break off into those groups and ask you to introduce yourself, share your name and your role, whether you're a MAC or BAC member or just an attendee, and one boring or interesting thing about you, you can pick. And then share what brings you to the MAC. So why are you here today or on a regular basis? What's your role or interest in coming and attending? And then share what topics would be interesting for you for the MAC to address at future meetings. So what would you like to see on the agenda? This could be a concern, an issue, or one positive thing that you think would be appropriate as a MAC topic. And I'll ask you to hold on to that thought because that question is in the post-meeting survey so that we can collect some of your ideas for future meetings and help plan agendas. So I will paste these questions in the chat for you so that you have them. And then I'll go ahead and break us out into breakout rooms. Everyone is assigned, so it should automatically pull you into your breakout room. If I happened to miss you and you are still in this main meeting room, I'll be here and I will get you into a breakout room as quick as possible. We are going to have about 15 minutes for this activity. So thinking about 2 minutes per person when you go around and share. And then I will also give a warning, a 2-minute warning before we come back as a group so that you have a chance to recalibrate if timing didn't quite work out. Does anyone have questions before I hit the go ahead on the breakout rooms? Okay, enjoy getting to know each other. The rooms are all open.
Get the thing that you wanted to lift up for future MAC meetings because there'll be a chance to share that in a survey. And we really are looking forward to seeing all of those. Okay, so now I'm going to pass it over to both Michelle Probert and Ian Yaffe to talk a little bit about the federal updates.
Thanks, Kathy. So quick change of plans this morning. I was going to share an actual PowerPoint deck, but we had a meeting of a number of different offices within the department this morning, and it's just it's too much information and too overwhelming and too much to get through in a short period of time. So I will apologize for not having a visual for folks who prefer to have something to look at, but I'm just going to go through some talking points at a higher level, which I think will make things a little bit easier to digest. And Ian and I will just both chime in with each other as makes sense. So just to ground everybody, there's been a lot of different names for this thrown around, but the Senate and the House at a federal level went through what's called a budget reconciliation process. So you might have heard budget reconciliation. The House passed a bill, and then the Senate passed a different bill, and then the bill went back to the House. They passed the same bill. You may have heard this get referred to as the so-called Big Beautiful Bill. It passed both the House and Senate and then was signed by the president last July 4th, last week. And it has now become HR 1. So those are all different names that you might hear that all refer to the same bill. And just as a note, it's been fairly common for Congress to use budget reconciliation as a vehicle for passing things, in part because when you can tie something back to the budget, you only need a simple majority in order to pass it. So often Congress prefers using budget reconciliation because, again, it is easier to get the votes you need in order to pass something, because you only need 1% over half in order for the bill to go forward. And that is mostly what happened. If you've been if you've been listening at all to the news or reading the news, you've probably heard a fair amount about this bill, especially over the past week or so. And I know that a lot of folks are concerned about the impact. And the first thing that I want to be really clear about is that there's one exception that we will talk more about, but from a Medicaid perspective, which in Maine is MaineCare, there are no changes to current coverage or eligibility requirements or processes until the fall of 2026. And so we are going to be working on a message to members, letting people know that they should continue to fill their prescriptions. They should continue to schedule and go to their regular medical and healthcare appointments and programs. That, again, I'll talk about the one exception, but things for right now continue as they have. The big potential member-facing impacts for some groups will not come for over a year. And for any changes, people will hear directly from the department, from MaineCare, from the Office for Family Independence before things go into effect. For members here today, for people who serve and interact with members, or people who might be applying, just right now, there are not changes. Because I said there is one exception, I will talk about that to start. So one of the provisions in HR 1 that passed, basically nationally, it mostly is a ban on one provider, and that provider is Planned Parenthood. In the state of Maine, this provision also impacts the family planning agency, Maine Family Planning. For those organizations, and there were a number of criteria that ended up only pointing, again, to those two organizations in Maine, but basically they will no longer be able to receive federal Medicaid dollars for the services that they provide. And if you're not aware, the family planning agencies provide, in addition to important reproductive health care and access to birth control, they also do cancer screenings. They provide basic primary care services, and they will no longer be able to receive federal dollars for any of those services, provided after the date the bill passed, which was, or on or after the date the bill passed, which was July 4th. In the state of Maine, we have state law that requires coverage of abortion services. For the most part, with very few exceptions, abortion services are not covered by Medicaid federally, already did not receive federal match. And so we are going to continue to cover and pay for abortion services for those two providers, as well as others, for services after July 4th, and that will not change. But there are about 5,000 MaineCare members who have received services over the past year at those two organizations, non-abortion services specifically. And so if that is their regular source of care, or even if it's just an occasional source of care, there may be access issues, and we can't speak to how those organizations are going to respond, and if they, so we'll let those organizations speak to their patients about continued access to those services. But that is the one immediate impact of this bill that will impact some of our members. So I'm going to go back up to Luke. Go ahead.
Michelle, I have a very targeted question. I have a child who received a liver transplant in Maine, and that was made possible, not in Maine, but in Boston, but that was made possible. Sorry for asking you a very personal question. That was made possible thanks to MaineCare. And so because I don't know about the transplant per se, but I know that the care for her to be maintained alive while she was on the waiting list, and then for her to be referred in Boston was made possible because of MaineCare. And I know the hospital was willing to give a generous transplant. That's what I was told down in Boston. I don't know about the specifics of payment around that, but she was given 5 months to live in the Congo, but she's 8 years old in Maine, meaning that without this care and coverage, we're gonna lose her because of the anti-rejection medication she takes. Now, I know that the immigrant community was targeted by the bill in a sense, and I'm asking myself, should I expect when it becomes implemented, my daughter to be kicked out of the coverage group, or is she going to be allowed to continue? I just don't know how specifically, but that's the question I have in mind.
Thank you, Luke. So I am going to talk about the changes to the current law in 3 main buckets. First, I'm going to talk about impact to people who have been on Medicaid expansion. And then I'll talk about other changes for coverage, which will answer your question around immigrant groups. Although I will give the quick answer that kids and pregnant people who are immigrants will still be able to receive care. So that's the quick good news there. And then yeah, I think I'll just, so those are I'm going to cut the third category. So those are the 2 main categories that I'll talk to. And I think just in the interest of time, we'll probably hold questions till the end. So in one respect or another, you could say that this bill it impacts our whole program. So from that perspective, it impacts all populations and also has implications for healthcare providers and therefore our bigger economy and all of Maine. But when you look at the specific provisions with direct impact to members, there's a particular impact to the Medicaid expansion population that includes adults without children, as well as parents and caregivers, where we don't have documentation of a disability and they are under 138% of federal poverty level. So I'm going to go through some of these pretty quickly and ask Ian if there's places where he wants to chime in. But for that population, starting in 2027, right now, since the end of COVID and the unwinding, members have to demonstrate that they're eligible every 12 months. Starting in 2027, that is going to change to every 6 months. Also starting in 2027, right now, there's retroactive coverage of 3 months for the expansion population, and that is going to be decreased for that population to 1 month. When I move beyond expansion, we'll talk about some other retroactivity changes. And then also specific to the expansion population, this doesn't go into effect until October of 2028, but there will be required copays for many services. We're still analyzing whether or not that is different from what we already do in Maine, and so that there will be more to come on that. The biggest impact that you may have heard about already is that there will be new work requirements for the expansion population, and that you may also hear that being referred to as community engagement requirements. That's a term that they've come up with on the federal level. Actually, sorry, I forgot to pause like I said I would. Ian, Did you want to mention anything about those other eligibility changes that I went through?
I think yeah, I mean, the only obvious one that I just want to highlight is that Maine, for non-citizen changes, that Maine still has the state-funded program for non-citizen kids. So I think particularly for folks to know, like, there are some people that may shift, but kids, regardless of immigration status, will still maintain eligibility for Maine Care. It's just a question of like what pathway, but it won't change the eligibility experience for those for kids. It just changes where they might land on a federal versus state perspective. That's not true for other folks, but for kids, I just wanted, that's the one thing that's particularly clear, because Maine has a state option in addition to federal options that permit states to extend eligibility for certain kids and pregnant folks. There's a state option here that provides an additional layer of coverage beyond that.
And to answer the question in the chat, yes, that also applies to pregnant people, because we have an option under the Children's Health Insurance Program, and there are also other exceptions for certain non-citizen pregnant people where they will continue to have coverage, and also we will be able to get federal match for those services. So since we're already talking about immigrants and non-citizens a couple times now, we'll circle back to work requirements in a minute, but what you may have heard about is that one of the things that did pass through HR 1 is that a number of groups starting in October 2026 will no longer have Medicaid. And this includes so individuals, non-citizens with a formal status as refugees, individuals who've been granted asylum. So these are the groups that historically have received federal match and been eligible for full Medicaid, but they no longer will be as of October 2026. So refugees, asylum grantees, victims of trafficking and spousal abuse. That is not a comprehensive list, but there are a number of non-citizen groups that will no longer have access. Again, as Ian said, that children and pregnant women, pregnant people in those categories will still have access, but non-pregnant adults will not. And our estimate is that, and we'll come up with a more precise estimate, but that is around 3,000 individuals. So that, again, is a change that would go into effect in October 2026. There's not another good source of healthcare coverage for these individuals, and so clearly concerned about access to care. They will continue to have access to emergency Medicaid. So again, for emergencies, we will be able to provide Maine Care coverage for emergencies, which is true nationally as well. Okay, I'm going to go back to the work or community engagement requirements. Those will start in 2027, January 1st. The basic requirement is 80 hours a month of work, community service, or education. Because we have a higher minimum wage, the guidance specific to Maine might end up looking a little bit different, but we're still figuring out the details there. This applies, again, just to the expansion population. It's important to know, and you're not hearing this much in the news stories right now, there are many exceptions to the work requirements. Individuals that are pregnant, that are receiving postpartum coverage, parents of kids who are under the age of 14, individuals who have chronic conditions, individuals who have substance use disorder. Those are all examples of individuals who are able to get an exception from the work requirement. And there's also a provision in the statute that specifically gives states the option of not having to require verification of meeting that exception status. So in other words, somebody could just say, yes, I have a substance use disorder, and they don't need to show like a diagnosis from a provider or anything like that. And it's the state options to kind of take that checkbox or self-attestation as an indication that they can qualify for an exception. Our current estimates, and this is based on a very small number of states that in the past implemented work requirements. And so this is really a guess, and it depends on a lot of factors, including what the broader economy looks like and how effective we are with our systems and our outreach. But our guess, which is the best that we can do right now, is that we would expect over 30,000 individuals to be disenrolled. And this isn't, it's not as simple as who's working versus who's not working. It's also, do people know about this requirement? Are they still able, living in a place, or do they have the access to their computer or their phone in order to receive notices so that they know what's going on? Individuals, I mean, in Maine, we have a lot of seasonal workers and people who are experiencing a lot of stressors and challenges with housing and transportation. And so caretaking responsibilities, all of those things make it harder for people to hear about these requirements and be able to respond in a timely manner to those requirements to make sure that they keep coverage, even if they're already meeting work requirements. And obviously the ability to meet work requirements depends on the broader economy and how many jobs are out there and available, and many other factors. So it's critical. Our partnerships with all of you who are on this call, providers, advocacy organizations, members, to be able to really get the word out and the outreach and making sure that we're reaching people, I would say similar to how we did during unwinding after COVID, is just going to be so critical to making sure that everybody who can is able to maintain their coverage. And in addition to partnership and outreach, another really important piece is that, and this is a requirement in statute as well, is that states have to use the data that's available to them to be able to indicate, to the extent they have the information, if people have met the work requirement or if they qualify for an exception. And so basically the state itself is supposed to, using its own data and systems, make those determinations wherever it can so that hearing directly from the member is not necessary in all cases to show whether or not somebody meets the requirement or an exception. That's not an easy thing to do. Systems are complicated. It can be very costly, but it's a requirement. It's the right thing to do, and something we will be working on very closely. Ian, before we take questions, what else would you like to say about work requirements?
One thing is, so the ex parte or the automatic renewal process doesn't go away just because we have work requirements, but people would need to meet those through that process. So I think our major focus, at least initially, is trying to figure out how exactly all the exemptions are going to work and where we might have an available data source to prove that somebody meets an exemption. We already have a planned exchange that will begin with the Maine Department of Labor to get wage data. So I think for people who are working, we'll have expanded information about their wages this year, and we'll be able to get a better sense of who is impacted there. But the major focus is going to be on how can we automate the process to know when somebody has met an exemption, particularly at renewal, because that would enable the continuous renewals. For those folks, if we can automate the work requirement part and they already meet the other parts of automatic renewal, which is still 80% right now, that means there wouldn't be much impact to them, and there wouldn't be much impact to our staff to process those manual renewals and manual verifications. But for people who we aren't able to do that, we will need to do a lot of outreach to make sure they know what to do, because these things will come up. It'll just be a really big change to how people experience MaineCare, particularly expansion members who have only really gone through a regular renewal process once in the past 5 years. The other piece there is the requirements apply both at time of application and at time of renewal. So that'll be a change to people applying for MaineCare will need to have demonstrated some compliance with these if they're subject to them. So again, it's a lot of work, but I think Michelle's points of the outreach will be really critical here, with the only note of like in a year or I think right now the danger is for people to start trying to figure out what to do today with these things when we just don't have all the answers. And so for most people's next renewal cycle, that will happen as normal, like right now. Nobody's renewal right now is going to be under any of these rules. We also will start figuring out outreach of, there are certain different program, like there are different qualifications for MaineCare. So we'll also try to figure out outreach for people who may, particularly people with disabilities, who may want to start, going through that process before these come into effect, instead of waiting until then if they're currently enrolled as expansion members. But lots to come on that soon. And by soon, I mean in the next several months or year, not soon as in like in a couple weeks, we'll know what this is all going to look like. And then we'll tell you. It's really, we're talking more like a year until we really will have solid information about how everything is going to work.
Thank you, both of you for that overview. I see there's a bunch of questions, both hands raised and in the chat. We don't have time to do a lot more on this. So I think what I'm going to ask, because none of these changes, except for the piece that Michelle said is related to care at Planned Parenthood and Maine Family Planning, goes into immediate effect. So even though this is stressful and we definitely want to be ready for all of it and get good information out to people, these are not happening right away. So let's plan that at our September meeting, we'll put some more time aside for this. And I'm going to ask that people, unless your question is about the Planned Parenthood Maine Family Planning piece, that you put your question in the chat and we'll capture them so that we can bring answers if possible to the next meeting. And if the question, and if you have a question that you haven't yet raised your hand or put it in the chat, you could also include it in the comment section of the survey after this meeting. So if your question is anything other than related to Planned Parenthood and Maine Family Planning, I'm going to ask that you hold them for the next meeting.
Kathy, can I just jump in real quick? And I'm going to drop Consumers for Affordable Healthcare's number in the chat. So if people have personal questions that they want to explore, they can call us. And if we don't have the answers, we'll work on getting those. So if people are feeling really anxious and just want to talk to somebody, they can call us. So I'll drop that in there for those people as well.
Thank you so much. And also just note that Maine Equal Justice will also be trying to get good information out to people soon. And I see Rachel noting that wanting to be available to get information out to folks. And I think that's where a lot of us are feeling. So MaineCare and OFI folks, like, as a better handle is on what would make sense. Like, once you have your message for members, it would be really great to share that with the MAC as well, so that we can share that information out. And also, if there's other messages that would be helpful for us to get out to folks, please let us know, because we would really like to do that, and also for the back members. And hopefully all the back members are now on the MAC list as well. So you should get those emails too.
So I do have a little bit of a question about the Planned Parenthood Maine family planning ordeal.
Yeah.
Can we get that information over to the Be There For Me people so that they can drop that on the website? Because a lot of people are being directed there to get information and coordinate services for themselves, where case management is hard to come by. That's going to be some important information for them to have specifically.
That's a good suggestion. Thanks, Rachel.
Yes, thank you for that. And I'll just say, one, you can put questions in the chat, and as we're able, we can try to respond to some of those. Two, I said this in the chat, but the department has published a couple of blogs regarding potential impacts of what were at the time proposals. We are in the process of working on an updated blog post that will cover projected impacts of the more impactful provisions that have passed. So that is not available yet, but we are working on it and we'll publish it. As I think I noted, we'll be working on that very high level member communication, which again is mostly going to say, like, keep getting your care right now, and providing talking points to our member services for folks who call there. But welcome all of you to, again, just informally get the word out that with the exception of impacts for Maine family planning and Planned Parenthood, that we're talking about fall of 2026 before any changes. And so people shouldn't be taking any rash actions because they're concerned about their coverage right now.
Thanks, Michelle. And if folks are able to answer some of the questions in the chat, that's awesome. And also, if not, like, we can save those and try to address them at our next meeting or when appropriate, but based on the information that we have. Thank you so much. So next up is our our OFI updates. If there's anything other than the federal updates that you'd like to share.
Sure. There are a couple updates that I do want to share for OFI. We have some pretty significant changes that I hope will all be positive that we'll be making over the summer as a result of the biennial budget. And so for a while, I think I've heard of frustration of OFI's current call center process, where you call us and you have to speak to a clerical staff member, and then depending on your need, they'll transfer you to an eligibility specialist. And there's often a significantly longer wait time for an eligibility specialist compared to our clerical staff members. And so we are in the process of training our 45 clerical workers on the call queue into a new position of a Maine Care only eligibility specialist. And that means that starting later this summer, when you call OFI, you'll get more options, like press 1 for this, 2 for that, to figure out what kind of eligibility specialist you need to talk to. And then when you get put into the queue for that eligibility specialist, generally speaking, you'll be able to get that need met 100% by that person without needing to be transferred to somebody else. That doesn't mean that there won't be transfers. Like if you end up with a Maine Care only eligibility specialist and it turns out that you have a question about SNAP, we'll still have to transfer you to somebody that can do that. But we hope that it will really streamline the experience for people by ensuring that when you call us that you get to the right person the first time. It's not going to change a lot about our wait times because we're not adding more staff, but we are hoping that particularly for Maine Care only related questions, that those can get answered even faster than currently. And we will also be developing some new technology tools. We'll be adding more of those, like here's your wait time messages and options for being able to schedule a callback. And we're also hoping to add the ability to schedule a call with us on our website so that you don't have to call us at all. We can call you. And it, again, to help have a more predictable call center experience for people. And so those changes will occur. Right now, we're targeting call center changes for the month of August. And as soon as we have some finalized information about that, we'll make sure to share that with everybody here. And then we also, for people that receive SNAP through OFI, we have a vendor conversion happening. That's really more behind the scenes. So nobody's cards are changing. The number to call us isn't changing or anything like that, but a different vendor will be processing EBT benefits for us starting at the end of this month. And with that conversion, which again, if you have a card right now, it's the same card, nothing's actually changing. The biggest change with that conversion will come new account functionality for people that use the online services for those cards, in addition to a new mobile app that'll be offered directly by the EBT vendor. So there'll be just additional options for people to manage their EBT benefits with us. So I just wanted to make sure to share those things with you. We're really excited about the change to eligibility staffing here. And we hope that it'll enable us to provide better customer service, particularly on the phone, where we've been working on that for a while and we still want to make it better. And we also have in the budget our eligibility specialist positions were reclassed, which we hope will increase, which means they're getting a pay raise in non-state government terms. And we hope that will also improve retention there. And the more staff that we're able to retain, the more that we're able to have those staff actually processing applications and renewals and answering your questions and not in our roughly 6 months of training that it takes for somebody to go from being hired to actually being able to process MaineCare and SNAP decisions. So just want to share that news with you. Hopefully, again, good things. And then if you haven't heard about Sunbucks, I can put some links in the chat here, but I know we're short on time. We've issued over $10 million in benefits through the summer EBT or Sunbucks program, and around 60% of that has already been utilized by 90,000 kids in Maine, and roughly 99% of people are qualifying for that automatically with no additional application required.
That's terrific. Thank you so much, Ian. And then back to you, Michelle, if there's any MaineCare updates that are not specific to the federal changes.
Yes, and I will be pretty quick in the interest of time. So first, I just wanted to flag that we put into effect some cost of living adjustments to certain rates effective July 1. We're going to put links in the chat to those e-messages that give additional information. That the cost of living adjustment that we have rolled out, and some of those are taking a little bit longer than anticipated, were related to the supplemental budget that passed for fiscal year 25. For the biennial budget, there was a different, this gets confusing, but there was a different cost of living adjustment that will also be effective July 1 for a different set of services. That will not be implemented until late September because of the 90-day delay in implementation of the budget. But there's a message that we're putting in the chat also about that second COLA that will be implemented later this fall, but will be effective retroactive to July 1. Also, I wanted to flag that for those of you who didn't know, we were in a shortfall situation for fiscal year 25 for MaineCare. We received supplemental budget funds to be able to fully cover the cost of services provided. by providers, and we got access to that funding in late June. And for a number of payments that we were temporarily holding, we were able to successfully release all those payments and have resumed normal payment operations. We're no longer holding any payments for providers. So that is very good news. I also wanted to share some exciting news. There's a national organization called the Center for Healthcare Strategies. They are having a learning series specifically around oral health and improving the oral health workforce and therefore access to dental care. And Maine has been selected into that learning series. It's a great collaboration between MaineCare, our workforce lead, and the department's commissioner's office, the Children's Oral Health Network of Maine, the Maine Dental Association, Maine Dental Hygienists Association, and Maine Oral Health Centers Alliance. So we are really excited to be able to collaborate together on that important work. We've done some good and hard work around dental access, and it continues to be a significant challenge. So looking forward to that opportunity. Also good news, last Monday, we officially submitted our what's called an 1115 waiver, really catchy name, to the federal government. That is for our whole person care waiver. It does many things. Maybe we can also link to our department blog that describes that waiver, but I will note that one of the things it does is once approved, which will take a long time, it would enable us to provide MaineCare coverage to individuals in carceral settings so that they can make sure that they have the services that they need as they transition back to the community. So we are really excited about that waiver. Thanks, Kayla, for putting that link in the chat. And there will be, we've had comments, we had a comment period when we provided notice that we were applying to that waiver within the state of Maine. Now that we've actually applied, there is another comment process at the federal level. So if people want to comment, you are encouraged and welcome to do so. And last update, as part of our MaineCare rate reform, we have published our schedule for what we call rate determinations, which is our process to figure out what we should pay for services and how. So we had put out that schedule for 2026, calendar year 2026. And that is it for my updates. Thank you. Sorry it was so fast, but trying to be respectful of time.
That's okay. We're gonna take a 2-minute stretch break and then come back. But there's been a ton of information shared and want to give folks a chance to catch their breath. So let's take a 2-minute stretch break. We'll be back at 11:27. Okay. Hopefully, I know it was a very quick stretch break. Hopefully you had a chance to stand up, maybe shake it out, catch your breath, take a drink. I did just want to know, I know we did go through a lot of information in that block of the agenda. And I know we didn't get to, I'm sure there's questions that have come out of that as well. We will, over the next few meetings, try to create more opportunities to learn about some of the pieces that are regularly part of the MAC or part of our subcommittees. And just because not everyone probably knows this, we do have several subcommittees for the MAC. One is related to rates. So that's how much providers get paid for different services that they do that are covered by MaineCare. And while that is a provider issue in a lot of ways, it's also something that impacts access, because sometimes when rates are not adequate, when they're not enough for the service, it's harder to get providers to take MaineCare to do those services. And also it's way more complicated than that. That's why I won't go into all the details, but it does definitely impact people who are using MaineCare as well as the providers who provide those services. So if that's something you're interested in a few minutes, we're going to take a break. We're going to do breakout groups, and one of them will be related to that. So you're welcome to jump in there if you're more curious about that. And also there is a subcommittee that meets monthly that you're welcome to attend if you're interested. And Laura Cortez is the person who chairs that subcommittee. We also have a provider subcommittee, which at the moment has not been meeting because we don't have a chair for that subcommittee because the person who had been chairing it retired. We are going to put out another call for someone to take on that role this summer. So hopefully somebody from the provider side will be able to help take that on. And then we also have a dental subcommittee that focuses in particular on dental access. I chair that subcommittee, so if you're interested in that, please feel free to reach out to me. And I'll share a link in the chat that has link to our MaineCare Advisory Committee page on the website that tells you all this information. Because of time, I'm not going to go through and do a big overview of the draft bylaws. I want to give a huge shout out to Kayla Sargent, who really helped significantly in going through the bylaws and helping figure out what needed to be changed based on the new access rule. And really, this wouldn't have happened without her. So please give her applause and a cheer because she really made it happen. And I'm going to put in the chat a link. This was also shared in the materials. And there was also a PDF version. Thank you all for that applause. A PDF version of the bylaws that was also shared in the materials. If for some reason you didn't get that, send me a message and with your email, and I'll make sure you're on the list. These bylaws are already posted online as a draft because we had to post them this month based on the new access rule. And the access rule that I'm referring to, for folks who don't know about it, this was a rule for Medicaid programs. Every state has them, that the Biden administration did before it ended, which was intended, it did a lot of things, but most importantly for the MAC, it was intended to try to create more opportunity for members to participate in the MAC. So that's what created the structure for the BAC and created rules around how many members need to be from the BAC, and all those pieces are part of this access rule. And so another thing we need to do is update our bylaws based on the access rule. So there's a draft posted online right now. In September, we are going to vote on that. So if folks have questions about it, if you look at it and you're like, oh, this doesn't make sense to me, or I have concerns, please reach out and let's talk about it and see if we can, if we need to make additional changes. And also, now that legislative session is done, my schedule has freed up a lot. So if you would like to like look at it with someone, if that would be helpful, I'm happy to do that with you. Just reach out to me. And also I told Kayla I'm happy to come to the next back meeting if that's helpful as well. So please feel free to reach out if you have questions about this. With that, let's switch for another round of breakout rooms. And this time it's around topics where you get to choose your own adventure. And Kayla, do you want to say anything more about this?
Yes. So I'll put the descriptions in the chat again, just in case you haven't had a chance to see them or you want to make a last minute change to which one you're going to join. We're going to have 3 breakout rooms. One breakout room will be this main room that we're in right now. So if you're interested in breakout room number 1, which is the NOPR discussion, I'm posting that description in the chat. You'll stay put, you won't move. The other 2 breakout rooms will each have their own room. And so when I open those rooms, you'll have the option to opt in and essentially leave this to go join that room. When the breakout rooms are done, I will call everyone back to this main room. If you're in a breakout room and it ends early, you can feel free to join us in this room, but just be aware that the conversation may still be going on. I think that's all I have to say about these. All of the descriptions are now in the chat, and I'm going to open the rooms so that you can begin migrating into the room of your choice.
And while Kayla does that, I'll reemphasize what she said, which is if you want to be in the first breakout room, you're going to stay here. This is going to be focused on the pharmacy piece. If you're interested in rulemaking and that piece of work, that will be breakout room 3. And if you're interested in rates, that will be breakout room 2. And if you can't see the breakout room options, if you click down somewhere on your screen, you probably have something that says breakout rooms, or it might say more with ... And if you click on that, one of the options will be join breakout room, and then it will show you the breakout rooms that are 2 and 3. And again, 1, you don't have to do anything. And if you're having trouble, you could also let Kayla know and she could put you in directly.
All right. Jan, do we have you in this room? Okay, perfect.
Hi. Thank you, Kayla. Thank you, everyone, for joining this breakout room. Such an important piece. We're trying to get the word out for our unenrolled prescribers. This, of course, as Kathy had mentioned, it does affect prescribers as well as members, and more importantly, at the point of sale, what we would call POS. So with the ACA, the 21st Century Cures Act, the description Kayla had put in the chat just describes we're trying to outreach our prescribers who are prescribing when a main care member chooses to go to a provider that doesn't accept main care. When they leave with a prescription, they will, beginning September 1st, be required to enroll with main care in order for main care to continue paying for the prescriptions for the member. So we're just trying to get the message out to ensure that and outreach these prescribers for the members' sake to encourage them to enroll in main care as an NOPR. And it's a shorter enrollment and doesn't require the prescriber to take on main care members for services if they prefer not to. They can continue prescribing the medications without needing to accept main care payments. A NOPR, which is an acronym, is
non-ordering, prescribing, referring provider.
Thank you, Shannon. It doesn't, NOPR enrollment doesn't require you to take main care members. It's a quick enrollment, requires less documentation, and the enrollment is free to complete. So we're just trying to get the message out there to these prescribers that we can identify through that point of sale when a prescription currently right now is being processed through MEPOP's main point of purchase system. It sends a soft messaging back to the pharmacy as well as to the prescriber that you are not enrolled and you'll need to enroll. So we've updated. So what we've done with our communication plan so far is through our main point of purchase systems, we've updated our blast fax in May. We sent out the message that effective September 1st, we'll no longer process prescriptions by prescribers who are not enrolled in MaineCare, and also provides them with a direct communication line to our provider enrollment specialist, as well as Shannon Beggs is a provider enrollment specialist that has just chimed in, and thank you for joining us, Shannon. Gives a phone number, and then also we have a member help desk line where members can contact us anytime for any assistance that they need. So we've updated also the point of sale soft messaging, which is a little bit more direct, saying with the effective date of September 1st. And then again in May, we did a listserv for those prescribers that are that have applied to our listserv about this upcoming change in our pharmacy benefit. Also, we updated a new e-message in June, which has some question and answer documents that some prescribers might have. And we're currently have begun outreaching the prescribers that we know of, that we can identify, just to welcome and let them know that we need to request that they sign up to become an OPRA with MaineCare, so that their members are not disadvantaged when they go to the pharmacy. So we're trying to outreach all these prescribers, and that's where perhaps if there's any groups that we can bring this message to, I'm kind of looking for any other avenues where we put it on a listserv, but where else can we outreach? Who else that perhaps that you in your professional careers can we send this message to, so that we can get the message out, so we can be successful in enrolling these prescribers, and then at a result, right, not affecting the members that we serve.
Rhonda, to answer your question on why a member would see a non-MaineCare provider, there's several different reasonings. It could be a service that MaineCare doesn't cover, so they would be seeing that specialist for whatever this service is for. So they would go to them, and they would still write different prescription. And if they write a prescription for whatever it is, that's why Jan is saying that we wouldn't be able to fill that prescription after September 1st. We do fill them now.
Yeah, and just to give a couple of examples, I think like we often hear about this happening with people who might not be able to find a mental health provider that's accepting MaineCare in their area, or also dental providers. Even though we now cover comprehensive dental care, people can't always find a provider. So if you had, for example, you might be seeing a provider who is not accepting MaineCare, paying out of pocket for that coverage, for that care, and they might prescribe for you, say, an antibiotic because you have an infection. Or again, like you can't find a mental health provider, but they might be prescribing you some sort of mental health medicine. And so it is actually sadly a pretty common thing, I think, for people to see certain types of providers that they have to pay for out of pocket, but they used to be able to still get their prescriptions covered.
So that makes more sense to me, because there's also providers who will see patients pro bono and yet write a prescription. So yeah, okay, thank you. That makes more sense.
And thank you for that. And as we've identified about 2,100 out-of-state providers and about 680 in-state providers. So it's one is too many. So we're just trying to get the word out to try to educate. And our next plan is to actually communicate with the members that are affected, to let them know and make them aware so that either they can, like you said, choose if they can, find a different provider that might be in, taking on main care members, and try to help them navigate that. So we're just trying to minimize as much impact as possible.
Christy, to answer your question, sorry, Val.
No, I'm sorry.
Christy, so members, if a provider is not enrolled in main care, we can't advise that provider that they can't bill that member because they're not an enrolled provider. If they were an enrolled provider, then that's when policy says that you can't bill a member. Does that make sense?
Yes, I also raised my hand because I had some thoughts about ways. So it sounded like that if the scripts get sent into the pharmacy and then they run it through and find out, they're going to fax that provider and let them know, right? Because it would need, like, just like if someone was doing a prior authorization, like then it would kind of note that provider is not enrolled. So the pharmacy is letting them know. My other thought was I don't know if there's any way to so like some of the outpatient doctor's offices use like an electronic system. I don't know if there's any way to like have any messages with that electronic system to know that the script is not going to be covered because they're not enrolled through main care. I can't remember the one that I used to use when I worked outpatient, when I was sending in scripts for doctors, but that was that maybe if they see it like when they're prescribing, that might be like a note.
I do believe that's what, Jan, correct me if I'm wrong, but your soft messaging is going to the pharmacy, but the pharmacy's also relaying that to that prescriber. Is that correct?
That's the intent, is for the pharmacist to relay that back to the prescriber like they do today if there's a PA that's required. So we're kind of, hoping, right? We're partnering with our pharmacies to try to send that message back to the prescriber.
Right. I was thinking also like the electronic, I don't know the connection with main care and like those electronic systems are sending the prescription in over, if like there may be a way to send the message that way, because they get on that multiple times a day. So if they had that message pop up for them, it would be like, oh, okay, I have to address it. And whereas like the prior authorization, like if a prior authorization like fax goes through, it goes to office staff, hopefully, and then goes to the doctor.
I do
and so
believe that's
sometimes
how
those
it's
things
done.
can get missed, especially if it's somebody that does like hybrid type of work where they work from home and they're not always in the office. So that was my thought. And also maybe like, I don't know if there's any way to just send the message to like send a notice in the mail to offices. So that way that people are aware, just like as a blanket statement to the office, like starting September, like if you're not enrolled, like we can't fill the script for your patient. So that was my thoughts.
Those are all great thoughts. And we are planning on sending out like you said, a generic to these prescribers that we can identify today. We're trying to like call them, right? Because this is crunch time, right? So we're going to do that. And then that soft messaging, that is all electronic, like what you've described. That is electronic through the claims processing, through NCPDP, what they call National Pharmacy Processing Standards. And that does get to them, and they do see that. So we've allowed them with the soft messaging all this time to continue getting their prescriptions, but now this is the deadline. So we're hoping that they see that deadline, right? So we've allowed it, so they've been able to continue. thank you for your thoughts. Very important. I see another, Valerie, do you have a question?
It's just another place you might want to think about messaging is with primary care, because a lot of times the referrals to those docs are going to come from primary care. And so having the primary care office during that referral process say, unless you're a main care provider, you can't prescribe, please send any prescriptions to me. Then they can manage that prescription from the primary care. I don't know. But, you know, really that's the problem is somebody's going to go to a specialist or an external partner and not know. And I'm assuming that external partner for one patient, I'm concerned about the timing that it would take to enroll. And also the resistance and that might mean not having a visit. My other question is, does this apply to inpatient and outpatient?
This would be outpatient.
Inpatient and so just as an example, if someone was traveling, they had to be seen inpatient, they had imaging and they needed a prescription for dye for imaging from the inpatient lab, they could not get that.
Well, they would, because if they're out of state, and there was an emergency, we do retro those authorizations we have and those hospitals. So even though they're not enrolled, doesn't mean that they won't be able to get that service or get that prescription, because they would just have to bill it after the fact.
Got it.
I'm just going to confirm my own understanding, or that I understood what you said, because it was different from what I had understood. So this applies to physician administered drugs as well as retail point of service. Is that what we just said?
Correct. This is going to apply to all providers if they're prescribing. But let's say you are visiting out of state, like I go to Florida, but I get hurt out in Florida, that hospital's not enrolled. That hospital is then going to contact us at the provider relations department. We're going to backdate everything for them because we were just visiting. It's not something typical.
Okay, so I had envisioned incorrectly that this would be non-payment of like pharmacy claims for prescriptions, but this would also result in non-payment of medical claims. Is that what I'm hearing?
It could, yes. If they're writing a prescription, absolutely, Michelle, this could affect them as well. But me and Jana talk. What you're saying is two different perspectives, because retail is run through a point of sale system where the other side is run through the medical system. But either way, even if they had to go to a retail pharmacy, because they're in out of state, because they needed to get that medication, we could potentially retro that pharmacy to enroll. We could retro their enrollment.
Is it that common, sorry for the ignorant question, but is it that common for prescriptions to be required for physician administered drugs?
Yes and no. Yes and no. It could go either way on those, only because depending on the circumstance and what medication it is that they actually need, what the injectable. So it's going to depend on the scenario. I know that's not a great answer, but
I mean, I don't know if it helps, but some of my medications are considered physician administered, but my neurologist taught me how to administer them myself. So I have to pick them up at a specialty pharmacy, even though I can administer it myself.
yes. And in that situation, that goes through our medical system. Well, some of them do. The administration part, they don't bill for, but the medication, wait, are you picking it up at the retail pharmacy or are you picking it up at?
No, so I have to go pick it up in the hospital because it's considered physician administered, even though my physician has taught me how to do it myself because of the lack of appointment availability. So it's a little complicated.
It is, but I understand exactly what you're saying. So that would not be billed through a retail pharmacy. So that would be billed through the physician, like they would still bill it as a medical.
Gotcha, because the retail pharmacy says that they can't even put the order in for it.
Correct.
We've got the whole group back together now. Rachel, did you have your hand up for the pharmacy conversation?
Yeah,
Or-
I just wanted to touch base with Shannon real quick. And Shannon, is it okay if I email you later and ask you some questions about main care members who might be seeking emergency room services out of state and get some clarification on that from you? Because we've had some questions about that.
Absolutely.
Okay,
And
awesome.
I'll put my email right in the chat for you.
I've emailed you before, but I just wanted to
Oh.
make sure you were the right person. So we've chit chatted. You're always super helpful. So be on the lookout, and emails come in from Rachel.
Okay.
Thank you.
You're welcome.
Thank you all, and thank you for trying out a new way of doing our meeting. So appreciate everybody cooperating with that. So we've reached the end of our agenda. I did want to flag that our next full MAC meeting is in September, and that was also on the agenda. Again, if for some reason you're not getting the agenda items, you're not on our email list, just send me a message. I'll put my email in the chat. I guess I can't talk and do it at the same time. And then we also, I'll also try to follow up. I know there were some links shared in the chat that might be helpful for folks, and I'll lift back up again the draft bylaws. So I'll follow up with an email. I'm not sure it'll be today, but either today or tomorrow with that information. And Rhonda, to your question about the committee, anyone can join the committees. So I saw that you were interested, or several people were interested. So I tried to save the chat so that hopefully we can follow up with everyone who expressed interest in a specific committee. And then, excuse me, Kayla, I saw your hand and then I see other questions, but just want to make sure I'm not missing something.
Thank you. I just wanted to flag, I put in the chat a link to register for the next year's MAC meeting series. We're making this publicly available on the website now. So we've set up a password protected meeting series where folks need to register in order to get it. So if you could all please do that, you will then get the meeting series in an email that you can add to your calendar. And just to note, there will be a password provided in that email to join. So that's one change.
Yes, thank you. I forgot to lift that back up. Sorry, my allergies just kicked in. Rachel, did you have another question, or was that still your hand up from before?
I have a different question.
No, I'm taking my hand down.
Oh, I'm sorry, other Rachel, and then you, Rachel. All right, Rachel took her hand down. So Rachel Ward, you go ahead.
Is it okay for me to take the information shared in this meeting back to Maine State Parent Ambassadors to be able to just disseminate to the masses?
Yes, please do. Any information that you think would be helpful to them, we'd love for people to share that information out. Sorry, my voice just went wacky. And it's a public meeting, so anything that's shared in the meeting is public.
We do record these meetings too. The breakout sessions where folks left the room won't be on the recording, but this main session will be fully recorded and available on the MAC webpage as well.
That's right. Any other last questions before we end today?
Sorry, I didn't raise my hand. I am just wondering, somebody had asked how to share links from my presentation on the rate form process with them, but I didn't get everybody who attended's email. So is there a way to know who attended so I can send those links out to them?
Yes, thank you for flagging that. I have that list now, Mandy, so I'll make sure I copy it over before I close the meeting.
All right, thanks.
Also, if you think it would be helpful to share with the whole MAC, I'm happy to include it if you send me what you shared.
I did put it in the chat, but I don't know if everyone saw it in there, but yes.
Okay, I'll grab it from the chat.
Okay.
Oops. Sorry, I was just trying to make sure I actually had saved all the things in my meeting chat. Okay. Any other last questions? Great. Well, thank you all so much. I hope you have a wonderful rest of your day and summer, and we'll see you all in September.
Please take our survey about the meeting today.
Oh, yeah, please take the survey. I will also include it in the email. Yes, but it's there to do right now, so you don't forget.
Thanks, everyone.
Thank you all.
Thank you.